Hi, my name is Sarah. I'm a pain management nurse at a medical center here in Georgia, and I've been a nurse for the past 12 years, and I would love to give you some information on what it means to be a nurse. You have a variety of education routes to take in order to become a nurse, but I really wanted to reinforce that being a nurse and being in nursing is meaning that education is always changing, it's ongoing, and it's a career where you're expected to keep up on the changes in the medical field. The routes that you have in order to become a nurse is you could go to a one-year program at a technical school and become a licensed practical nurse, which is a nurse that works alongside a registered nurse. As an LPN, you will primarily find you can work in doctor's offices, same-day surgery facilities, and long-term rehab facilities. You can become a registered nurse with an associate's, which is a 2-year program at a college, or you can go on to obtaining your BSN or MSN, which is 4 to 6 years. Registered nurses have many options on where they can work. If you're an RN with your associates, you can work in a hospital. However, you would have to be enrolled in a RN to BSN program because hospitals will only take nurses with a bachelor's or higher. Depending on what field you work in, you may be required to obtain extra certification, and all nurses have to maintain CPR certifications and the licensure in whatever state that they work in. For salary, on average, a nurse can make $50,000 to $150,000 a year, depending on the educational route that you choose to take. Being a nurse, you will always have job security. That's because there's a high demand for nurses because we're considered essential workers. Essential is a word that I know that a lot of us hear recently due to the COVID-19 pandemic, but not everybody knows exactly what essential really means. To be essential means you are indispensable, you are vital, and you are extremely important. People are relying on you to help them because they cannot help themselves in that moment. If you want to make a difference in someone's life, if you enjoy helping others, and if you like high intensity situations, being a nurse may be the route for you. But you can always hear from other nurses on what it means to be a nurse for them and what they do on a daily basis. All right, thank you.
Hello, my name is Brandy and I'm a pediatric nurse, and I work specifically with patients that have allergies, and that can be seasonal allergies, allergies to animals, or even allergies to food. And I also work with patients that have asthma. So what I do specifically is work with the doctor in a doctor's office, and when I do that, I administer skin testing, which determines which type of allergies that a patient might have. I also give allergy and asthma injections, and then I also do something called a food challenge. So what a food challenge is that patients come in and they may be allergic to a specific food, and we give them the food and we just monitor to see if they have a reaction. So I really enjoy doing this job, or I really enjoy being a nurse, because I get to help people. I know that's a cliche, but it's really rewarding to see when people start off here compared to how they end up, especially after giving the allergy injections or the asthma injections, because the kids come in and they're really sick.
They do it. All right, good morning, girls and boys. My name is Azzy, and I am a registered nurse. I do want to first of all say hello. Thank you guys for all the love and support that you guys have shown us in the past couple of weeks due to the recent pandemic. I do want you guys to also know that being a nurse provides me the opportunity to come in contact with all people of all different walks of life. It allows me the opportunity to love the ones who can love themselves and to care for the sick, both children and adults. This career has afforded me the opportunity to achieve great things in my life. I love being a nurse. I love taking care of people, and it's something I will do for the rest of my life. I want each one of you to know that as you pass a nurse in your day-to-day lives, stop and let them know how important their jobs are in your life. As you grow up, please consider being a nurse or a doctor. It will give you a life of great success and fulfillment. Once again, thank you for all the love and support. Being a registered nurse is a great job. Have a great day, everybody.